Hello and welcome to today's TED Ed session. Today we will be discussing person-centered care. Person-centered care is an established framework of uniform standards used by medical practitioners, including nurses, to provide wholesome and enabling care to treat the patient's full needs. McCormack and McCance's person-centered care framework is a model developed to encourage better nursing practice and consists of four main elements: prerequisites, the care environment, the care process, and person-centered outcomes, which when combined constitute some of the best and efficient nursing processes. Benefits of the framework include putting the person's wants, needs, and desires above our own to allow us to provide the best possible care for the patient, as it ensures every aspect of their care is individualized towards them. It speeds up the process so we can decipher what they want in early stages of care and builds rapport with the patient. Happy patient equals happy. While we know that a happy patient should equal a happy nurse and therefore a happy organization, we know this can't always be true. However, it is the goal, and this framework allows us to move towards the goal more fluidly. All aspects of the person-centered care framework must be linked together to enable the best care possible. Within the care process, there are 5 critical components which have been established to support a simplistic but effective model for achieving person-centered care. Firstly, working with patients' beliefs and values, engagement, shared decision-making, having sympathetic presence, and providing holistic care.
McCormack and McCance states that working with the patient's beliefs and values reinforces one of the fundamental principles for person-centered care, which places an important picture of what the patient values about his or her life and how he or she makes sense of what is happening. In order to work with the patient's beliefs and values, one must be aware about another person's beliefs and values. This requires care for the patient in a way that appreciates the understanding of each patient as an individual human being. This caring knowledge is vital for person-centered care because it helps to determine what the needs and desires are for the patient and what course of action needs to be taken for their care. In order to effectively work with the patient's beliefs and values, nurses must show a respectful attitude towards their patient and actively listen while being able to understand the requirements that are needed to fulfill their beliefs and values. It is also important to establish a trusting relationship with the patient and their families. In the Nursing and Midwifery Board of Australia, NMBA Code of Conduct 2018 states that nurses must respect the dignity, culture, ethnicity, values, and beliefs of people receiving care and treatment. But what does that mean? It means that in planning and providing effective care, nurses must uphold standards of culturally informed and competent care. This includes working around the patient's ethical values that they may have in the healthcare system. This can give a patient a sense of support and make them feel safe within your care. As a nurse, it is wrong for you to impose your own values and beliefs towards the patient, as this may make the patient feel discriminated against and uncomfortable within your care. In order to achieve a culturally safe work environment, nurses must examine their own values and beliefs and how these may differ from others. It is also important to understand discrimination in all its forms. This will provide a broader understanding towards the patient's beliefs, values, and needs for their care.
Now focusing on to engagement, and why is it so important in person-centered care? High-quality healthcare is based on an open and effective two-way communication between the patient and nurse. A goal outcome that comes with person-centered care is to have the patient feel involved with their care and health outcome. In order to do so, engagement is a crucial aspect. By enhancing engagement, it not only builds healthy relations and rapport between the nurse and the patient, but it also betters the patient's knowledge and understanding of their own healthcare. With this, the patient is able to provide feedback and welcomes participation on making informed decisions regarding their recovery, which, according to Bob Price, represents an opportunity for celebration or improvement of care standards, as in his book, Nursing Standard, published in 2006. Another important factor in engagement is establishing connection. with the patient. As age differs, there comes with plenty of different values and beliefs as well as with culture. Being able to sustain this relation will allow for the patient to build trust within the nurse and provide comfort as they express their values and cultural beliefs.
Shared decision-making and its place in healthcare. Allowing the patient and health practitioner to collaborate in health choices and strategies is regarded as an ideal platform for clinical decision-making. Shared decision-making works to accommodate the patient's preferences of healthcare action while being guided by the practitioner to achieve improved outcomes in an environment of equal power. The advantages of shared decision-making. Combining the expertise the practitioner has on health disorders and interventions with the special knowledge the patient has regarding their own well-being. Increased patient involvement builds comfort and trust between the healthcare worker and the patient. Further advantages of shared decision-making. Leads to higher patient compliance. Helps reduce any negative stigmas certain individuals may have against medical professionals. Improve rapport between clinician and patient. Encourages expression and honesty, allowing for a more holistic approach to healthcare. Preventable barriers to shared decision-making. Little face-to-face time between the patient and health workers can be inadequate time for proper shared decision-making. Patients being seen by multiple healthcare workers can feel left out of decision-making due to health professionals working amongst themselves and not with the patient. Non-ideal environments where patients are in close proximity can result in lower privacy and too much background noise, which can impede patient and healthcare worker communication, lowering the ability for shared decision-making. Lack of cultural understanding from healthcare workers can cause poor communication when working with patients of Indigenous or ethnic backgrounds. Preventable barriers continued. Patients sometimes do not trust healthcare workers. Patients can sometimes believe that the healthcare worker always knows better than themselves. Lower input from the patient from fear of being seen as an inconvenience to the healthcare professional. Barriers to shared decision-making. Non-preventable. The cognitive function of the patient. Possible age-related factors. Specific patient health background.
In order for nurses to effectively engage with a patient and build a therapeutic relationship, they must be consistent with person-centered care. They must consider the patient's needs, values, beliefs, and decisions, and they must be sympathetic. Having a sympathetic presence involves tactics such as active listening, being attentive, being mentally and emotionally present, and feeling sympathy towards the patient. To effectively maintain a sympathetic presence, it's important to understand and respect the patient's past traumas, limitations, and losses. Sympathetic presence will assist nurse collaboration with the patient, their family, and the multidisciplinary team, and will achieve the best outcome for the patient. Having a sympathetic presence can empower patients and assist them to make informed decisions about their care. This presence is essential when trying to develop a therapeutic relationship. This will result in a more positive healthcare experience. Potential barriers could be time restraints, past experiences from patients, beliefs or prejudice, lack of trust, lack of privacy, other health conditions such as mental or cognitive, or cultural differences.
Is generally defined as all nursing practice that has the healing of the whole person as its goal. A holistic nurse is a nurse who takes a mind, body, spirit, emotion, environment approach to the practice of traditional nursing. Through providing holistic care, a nurse should approach healing from all vantage points, including the patient's idea of health, health beliefs, and values. Applying holistic care requires determination and commitment to partnerships in their learning process, as treatment for all patients will be different. This is due to the nature of a holistic approach. Effective communication allows nurses to gain a deeper understanding of the patient's needs and is transcended through a nurse's ability to listen thoughtfully. Benefits of holistic treatments include quicker relief for pain due to all components of the person's health being assessed, Underlying ailments and comorbidities can be assessed and treated in full, leading to improvement of overall general health. Understanding the need for a well-balanced lifestyle through discussing approaches for eliminating root cause. Holistic care can also include the use of more natural resources such as natural herbs and medicines in conjunction with modern substances. Natural remedies, while often forgotten, have been around for centuries and complement modern medicine to provide a more balanced, all-rounded treatment plan. Application of more natural methods to cure illness such as proper nutrition, exercise, detoxification, and other natural non-invasive treatments. Holistic care focuses on the root cause of the disease, and the goal is to eliminate the disease by encouraging the person to strive for wholeness and healthy living.
Person-centered care cannot be delivered successfully without a good established leadership system. However, when delivering person-centered care, nurses may face leadership challenges that could inhibit the effectiveness of the care they provide. These challenges include leadership hierarchy issues. It can be challenging to make sure that leaders within the nursing team are open to implementing and supporting the person-centered care framework in order to achieve patient satisfaction. Breaking down this hierarchy is vital in order to effectively deliver holistic care. It may be helpful to explore a task-based approach in which all nurses understand the patient needs. Communication barriers may also inhibit the person-centered care, when miscommunications can create an uneasy workplace environment for both nurse and patient, and where communication issues facilitate misconceptions that lead to patient care being compromised, leaving the patients unhappy or uncomfortable with the care and treatment they have received. An unshared workplace vision without an established common goal may make it harder to successfully deliver person-centered care. A strong leadership team must create a clear vision that reflects the 5 main principles of the PCC. Another barrier in leadership is the lack of understanding of the effectiveness and importance of the person-centered care model. Within leadership, there may be a variation in what each person believes patient-centered care involves. These variations are mostly due to nurses having different values and beliefs underpinning how they practice person-centered care. To conclude, the person-centered care framework allows for some of the best and efficient nursing processes when applied effectively by all members of a nursing team. In order to enable the best possible patient care, all aspects of the person-centered care framework must be used together. This includes working with the patient's personal beliefs and values to establish effective engagement between patient and nurse, which includes engaging in a shared decision-making process whereby the patient feels safe and supported. From this, holistic care is provided to encourage the patient to strive for wholeness and healthy living. Practicing patient-centered care focuses most on putting the patient's wants, needs, and desires above our own. This allows us as nurses to ensure that every aspect of care is tailored to them. It is also highly effective in speeding up the care process as well as building a successful rapport with the patient. Patient satisfaction may only be achieved through power sharing, empathy, and building a genuine rapport with the patient to successfully provide patients with a sense of support, safety, and wellness.